Hi everyone, my name is Navin and my son name is Akshit. We are from Hyderabad, we stay in Uppal. My son is having with a high heart beating problem since last 5+ years. We got to know Dr. Soumen through one of my relative. He is also cardio specialist. He referred us when we had this problem 5 years back. I strongly recommend Dr. Devin Chovidatta. I say, he's one of the best, finest doctor in Hyderabad and of course in India also. He's very, the way how he briefs, the way how he handles a problem, he's really very supportive and he's like our family member. And last week when we visited doctor, I said, Akshit is like my younger brother and I'll take care of him very well. We were not mentally prepared for this RFA procedure, but doctor gave that assurance. And during the procedure also, he briefed us, he called us, he said, he very well explained about the problem, and he also said it's one of the complicated procedure, and unfortunately, it was very narrow, and for him it's very difficult to treat that also. And he explained us very well what happens if he succeed, what happens if he don't succeed, and then he gave us an assurance. I'll try my best, and he really supported us. And we were not ready to take the decision when he explained about the complexity of the problem. Like me and my wife were completely blank. We don't know what to say when doctor said either you would like to proceed further or you would like to take a back step. Right? He explained very well, like what happens if in case if we don't succeed. Right? And I'm sure, we somewhere, in the corner, we had that belief in the doctor, since he has, he's subject matter expert and he has huge expertise in handling this kind of complexity of the problem. We had that feel in mind, and we said, sir, please do whatever you feel good. Okay. We are not in a position to take a decision, but doctor said, fine, okay, rest, leave it to me, I'll do my best. And he said, I'm ready with my gun, I'm just waiting for your go ahead. I said, sir, I'm sorry, we are not in a position to say anything. We left the call to the doctor, and the doctor took the decision. And he said very clearly, fine, let me do my best. If I feel anything somewhere, if it is not going as expected, then probably, we will terminate the procedure. And I should thankful to doctor and the staff and the Apollo Hospital. They spent around 4+ hours for this procedure. I know it's not so easy for anyone, who can stand and, do the procedure with giving 100%, focus. And finally he came out and he said, we are succeed, and I'm very, very, very happy. Since we were having this problem for the last 5+ years, now we are completely get rid of that problem. And I should be thankful to Dr. Soumen sir for my entire life. And thanks once again to the doctor and the staff of the hospital and to the hospital members. Thank you.
Thank you.
Namaste viewers, I am Dr. Soumen. I am a cardiac electrophysiologist and cardiologist at Apollo Hospitals. I am really glad to bring you the success story of Akshit. Akshit is a bright young engineering student who is studying computer science. I have been following him up for the last 3 years. He was having repeated events of pretty serious arrhythmia where his heart rate used to really misbehave. Now arrhythmia, as many of our viewers would know, is a disease of cardiac rhythm. They have electrical rhythm disturbances inside the heart for multiple reasons. So Akshit was suffering with repeated events of a cardiac arrhythmia called SVT. Now many of our patients and followers would already be aware of the term SVT, which is a form of cardiac arrhythmia. The expansion is supraventricular tachycardia. Specifically in this kid, it was an accessory pathway, which is a technical term. It is a form of an electrical circuit abnormality. Often these people are absolutely normal in terms of cardiac structure and function, but they have excessive electrical conducting tissues inside their heart. Think of it as a bypass tract, a tract or an electrical circuit which bypasses their normal electrical circuit. And often there is an abnormal interaction of the normal circuit that we have inside the heart and the abnormally conducting tissue. And it behaves something like a short circuit, which causes a sudden rapid burst of heart rate where it can really shoot up In his case, his heart rate used to go up to 240. He used to feel severe chest pain, palpitations, and in fact, giddy symptoms. He was initially managing this with medicines, but he did not get a satisfactory relief. He often used to land up in the hospital emergency for stabilization, and we eventually proceeded with a 3D guided electrophysiology study and catheter ablation, and I'm glad after a long stressful procedure we could get the result and get him out of this mess. So now his rhythm is normal, and as he leaves the hospital, I wish him all the best. I really feel grateful for having this opportunity to have touched his young kid's life, be able to be constructively contributing in this manner. If you want to understand about this cardiac arrhythmia and more, and understand about electrophysiology, catheter ablation, which has really developed and grown in the recent times to treat cardiac arrhythmias, please do not hesitate to meet us in Apollo hospitals and we can discuss more. Thank you so much.